Imagine you buy this beautiful historic home, has all this incredible character, but one day you notice the living room floor is like starting to sag.
Oh, that's never a good sign.
Right. So you bring in a contractor and they give you two vastly different options. Option A, they tear up the floorboards, reinforce the underlying wooden joists, and, completely rebuild the foundation.
Which is the massive project.
Exactly. It's going to take 6 weeks. It's going to be a huge mess, and it totally disrupts your daily life. But then they offer you option B. They bring in a giant industrial heat gun, run it over the floor for 30 minutes, and the heat chemically shrinks the wood just enough to pull everything tight again.
And you can literally host a dinner party that same night.
Yeah, exactly. And most people instinctively gravitate toward option B, right?
Oh, absolutely. I mean, it is human nature to want the path of least resistance, especially when you're dealing with structural deterioration.
Right, but there's a catch.
A huge catch. Because if you take a heat gun to a load-bearing floor, you are fundamentally altering the chemical and physical structure of that wood.
So it's not actually fixing the problem.
No, not at all. So a year later, when the floor inevitably starts sagging again, and you call the contractor back to finally reinforce those joists, they might look at that floor and tell you the wood is now too brittle and fused together to even hold a nail.
Wow. So you solved the immediate cosmetic issue, but you basically compromised the structural integrity of the house for the future.
Exactly. You traded a quick fix for a long-term disaster.
And that analogy perfectly sets up our topic today. We've spent the week parsing through a massive stack of sources for this deep dive. We're talking FDA safety communications, clinical trial protocols, surgical journals, and we've been comparing all of that hard data against the glossy marketing materials you see from cosmetic clinics.
And the contrast is pretty wild.
It really is. The topic dominating all of these sources is the absolute boom in vaginal rejuvenation. Specifically, the explosion of non-surgical energy-based devices, which the sources usually just call EPDs.
Right. We're talking about high-powered radiofrequency wands and lasers that are being aggressively marketed to treat, vaginal laxity, stress, urinary incontinence, and what they call the genitourinary syndrome of menopause.
Okay, let's unpack this, because the demand driving this market is incredibly real. Women are seeking solutions for some deeply disruptive, really intimate health issues.
Oh, completely. I mean, laxity, for example, often stems from the massive biomechanical trauma of childbirth,
Yeah.
or just the natural aging process, or even significant weight fluctuations. The tissues simply lose their functional tone over time.
Right, the foundation starts to sag, going back to our house analogy.
Exactly. And alongside that, as estrogen levels drop during menopause,
Yeah.
women experience decreased moisture and thinning tissue, and that makes intercourse intensely painful.
Which is obviously a huge quality of life issue. And then you add in stress, urinary incontinence, that involuntary leakage when you cough or laugh.
Yeah, you suddenly have millions of patients desperate for relief. But historically, the options to fix these functional issues have been pretty brutal.
Yeah, the sources talk about how if you wanted to actually solve severe laxity or structural dropping, the traditional solution is a major surgery. It's called a colpopereneoplasty.
Right, and a colpopereneoplasty is a highly invasive structural rebuild of the pelvic floor. The surgeon literally makes deep incisions to access the muscular layers and the supportive fascial tissue that hold everything in place.
So they're going all the way down to the studs.
Exactly. They then manually reapproximate those torn or stretched tissues, physically suturing them back together to restore the original anatomy.
But the downside there is massive. If traditional surgery is like tearing down drywall to rebuild the structural wooden studs of a house, you are looking at general anesthesia, painful incisions, and a strict 4 to 6 weeks of recovery downtime.
Yeah, you are severely restricted in lifting, exercising, basically all normal physical activities. And, I mean, who has 6 weeks to just pause their life?
Almost nobody. And that massive barrier to entry is exactly the fertile ground where these energy-based devices took root.
Precisely. Our sources focus on the two main players dominating this space right now. First, you have radiofrequency, or RF devices, which operate under brand names like Thermiva or VIVEVE.
And then you have lasers, right?
Yeah, primarily CO2 or erbium.YAG lasers like the Mona Lisa Touch. And clinic marketing pitches these as painless 30-minute lunchtime procedures.
They literally promise zero downtime. They claim you can go to the gym or resume normal sexual activity the exact same day.
Which sounds like magic.
It does. So if the surgery is rebuilding the structural studs, are these energy devices basically just using a hairdryer to shrink wrap the wallpaper?
That is a brutally accurate way to put it, yeah. The underlying mechanism for all these devices relies entirely on thermal effects. They use controlled heat to purposefully irritate and injure the tissue.
Wait, injure the tissue on purpose?
Yes, exactly. The human body responds to that controlled thermal injury by contracting the existing tissue and initiating a massive healing cascade. You aren't rebuilding the studs at all. You are artificially tightening the wallpaper and just hoping the resulting scar tissue holds the wall up.
Wow. Here is where it gets really interesting because the science of how this heat physically alters human tissue is just wild. Let's break down what is literally happening inside the body during these procedures.
Sure. So starting with lasers, like the CO2 or erbium.WAG.
Yeah, how does shining a bright light into the tissue actually cause it to tighten? It sounds like sci-fi.
Well, lasers work by delivering highly focused light energy that is absorbed by the water inside your cells. And this creates sequential microtraumas. Basically, the laser blasts thousands of microscopic controlled burns across the surface mucosa.
Okay, ouch, but I guess you don't feel it.
Usually they use a topical numbing cream. But as the body rushes to heal those tiny burns, it sheds the old tissue and generates new, healthier mucosal lining. This process can significantly improve surface moisture and elasticity.
But one of our sources, a review by an expert with 25 years of cosmetic surgery experience, points out a huge caveat. They say this is just a repurposed facial skin resurfacing technique.
Right. It's the exact same laser technology they use to smooth out forehead wrinkles.
Exactly. So the biological effects are literally only skin deep. It doesn't penetrate into the muscle at all.
And that superficial limitation is exactly why the industry introduced radio frequency, or RF, because RF doesn't use light. It uses high-frequency alternating electrical current.
Okay, so electricity instead of light.
Yeah. And because it is electrical, it can bypass the surface layers and penetrate much deeper into the submucosa and the connective tissues beneath.
Wait, if it's sending electrical currents deep into the tissue to heat it up, why isn't it burning the surface layer on the way down? Like, how does it skip the skin?
It all comes down to electrical impedance. The tissue naturally resists the electrical current, and that resistance is what generates heat deep within the layers. Meanwhile, the wand itself often has a built-in cooling mechanism that actively protects the surface mucosa from burning.
Oh, that's clever.
What is? The goal of this deep electrical heating is to bring the submucosal tissue to a very specific, sustained temperature, usually between 40 and 45 degrees Celsius.
The precision required there seems terrifyingly narrow. I mean, if the tissue stays below 40 degrees, you don't get any structural change, right? It's just a warm massage.
Right, nothing happens.
But if you push that wand just a few degrees too hot, above 45 degrees, you are no longer stimulating the tissue. You are crossing the threshold into macroscopic damage. You're literally cooking the proteins and causing necrosis, which is tissue death.
Walking that biological tightrope is the entire premise of RF therapy. When you hit that exact 40 to 45 degree sweet spot, the heat causes the triple helix structure of your existing collagen fibers to instantly contract and thicken.
And that provides the immediate tightening effect patients feel walking out of the clinic, right?
Exactly. But the long-term play relies on cellular trauma. The heat stresses your fibroblasts, which are the cells responsible for building structural proteins.
So the heat basically wakes them up.
Yeah, in response to this thermal stress, the fibroblasts wake up and start synthesizing brand new collagen and elastin over the next few months. The clinical terms for this are neocollagenesis and neoelastogenesis.
Okay, so you plug a wand into the wall, it sends an electrical current deep into your pelvis, stresses your cells, and your body builds new collagen. On paper, it sounds like an absolute miracle.
It does sound great on paper.
But does that biological trick actually translate to fixing the patient's real-world symptoms? Because our stack of sources presents a pretty stark divide on efficacy.
Yeah, the clinical data requires very careful reading. Proponents of the devices frequently cite the VIVEVI trial. This was a randomized, single-blind, sham-controlled study.
And a sham control means the placebo group actually had a wand inserted into the vaginal canal, right?
Right. But the device delivered a clinically ineffective amount of energy, so the patients didn't actually know if they were getting the real treatment or the fake one.
And the data shows that at 6 months post-treatment, 43.5% of the women in the active RF group reported a total absence of vaginal laxity. That's compared to only 19.6% in the sham group.
Which is a statistically significant difference.
Definitely. We also have histological studies in our stack, mostly done on porcine or pig models, because obviously you can't ethically take massive deep tissue biopsies from the vaginal walls of living human patients just to see if a cosmetic wand worked.
No, you definitely cannot do that.
But in those pig models, a volumetric heating RF treatment actually resulted in a 1.7 millimeter increase in the overall thickness of the vaginal wall, alongside significantly denser elastin fibers.
So we can confidently say these devices create undeniable physical changes. The tissue gets thicker and it gets tighter. However, the limitations become glaring when you zoom out and compare these devices to traditional functional therapies.
Right, like physical therapy.
Exactly. A secondary randomized controlled trial in our sources compared a single session of radiofrequency against 12 weeks of pelvic floor muscle training. We are talking about guided physical therapy, targeted Kegels, and actual muscular rehabilitation.
And the timeline of those results is what really caught my eye. At 30 days out, the RF wand held its own. It was deemed non-inferior to the physical therapy.
Which makes sense with the immediate collagen contraction.
But when they checked back at the 6-month mark, the physical therapy group showed vastly superior and sustained improvements across sexual, vaginal, and urinary outcomes. The wand basically dropped off.
And the underlying anatomy explains that drop-off perfectly. Energy devices create a temporary contraction of collagen. But as a medical physicist and reconstructive surgeon bluntly states in one of the journal reviews, it is technically impossible to tighten the much deeper muscular and supporting fascial tissue that only surgery can achieve.
Because the thermal energy only reaches a few millimeters deep, right?
Right. If a patient's laxity is caused by a muscle that was physically torn during childbirth, a radiofrequency wand cannot magically stitch that muscle fiber back together. It only shrinks the tissue sitting on top of the tear.
Okay, so if the fibroblasts churning out new collagen don't actually fix the underlying structural damage, and the physical therapy outpaces the wand after 6 months, what happens when that patient inevitably decides the lunchtime fix didn't hold?
You mean when they finally decide to go get the definitive surgery?
Exactly. We keep talking about this heat altering the tissue. Does the fact that they've already, cooked their pelvic floor matter to the surgeon? Because this seems like the most critical question in our whole deep dive.
It is the most critical takeaway from the literature, without a doubt,
Yeah.
because you are no longer operating on natural anatomy. You are operating on artificially altered tissue.
And our sources have a specific case study about this, right?
Yes. An overview published by NICE, the National Institute for Health and Care Excellence, documents a highly revealing case report regarding this exact scenario. A patient underwent a laser treatment to address vaginal laxity and stress incontinence.
And I'm assuming the results didn't last?
They didn't. So 1 year later, she was admitted to the operating room for a traditional surgical posterior vaginal repair. But when the surgeon made the initial incisions, they documented that the patient's vaginal mucosa was highly abnormal.
Abnormal how?
The specific surgical notes describe the tissue as very thin, friable, with loss of rugae.
Hold on, friable. And what are rugae? Paint a picture of what those terms actually look like for a surgeon trying to operate.
So friable is a surgical term, meaning the tissue is incredibly fragile. Instead of being strong and elastic, it tears easily under normal pressure.
Oh, wow, so it just falls apart.
Exactly. If a surgeon tries to pass a suture needle through it, the tissue simply crumbles or gives way. And rugae are the natural accordion-like folds of the vaginal wall. They exist to allow the tissue to expand, stretch, and retract dynamically.
And this patient didn't have them anymore.
No, she'd completely lost them. The laser, which was marketed to rejuvenate her tissue, had essentially ironed out all her natural elasticity and left the area dangerously weak. The surgeon explicitly noted this altered tissue resulted in a highly difficult procedure with higher than usual blood loss.
But wait, that case report was about a laser treatment.
Right.
We just established that lasers are superficial, right? They rely on light energy that only goes skin deep.
Right. Superficial microtrauma.
So if a superficial laser caused the tissue to become so thin and friable that surgery became a messy nightmare, what happens if someone had radiofrequency? Because RS intentionally uses electrical impedance to penetrate deep into the submucosa and the fascia.
You're seeing the exact problem.
Wouldn't deep tissue thermal fibrosis make a surgeon's job even harder?
The urogynecologists authoring these reviews are raising that exact alarm. RF ablation relies on creating controlled thermal injury to trigger tissue remodeling. It does create new collagen. But in a deep tissue setting, that new collagen is functionally microscarring.
Oh man, so it's not healthy new tissue, it's scar tissue.
Yeah, you are tightening the area by leaving behind altered, dense, fibrotic tissue.
It's like trying to perfectly tailor a suit, but finding out someone has already superglued all the internal layers of fabric together.
That is a perfect analogy, because in pelvic reconstructive surgery, surgeons rely entirely on navigating what we call tissue planes. These are the natural, distinct, microscopically thin boundaries between the vaginal wall, the bladder, and the rectum.
And they need those boundaries to know where to cut safely, right?
Exactly. A surgeon needs to separate these tissue planes cleanly to access a torn muscle or repair a prolapsed organ. But if previous deep heating RF treatments have fused those delicate planes together with dense fibrotic scar tissue, dissecting them safely becomes treacherous.
Because everything is stuck together.
Right. You dramatically increase the risk of the surgery failing. And even worse, the surgeon is at a much higher risk of accidentally cutting into the bladder or the bowel because the natural anatomic roadmaps have been literally obliterated by heat.
That is genuinely terrifying. So, by paying out of pocket for a quick fix today, you could be making the definitive surgery you actually need tomorrow exponentially more dangerous.
Yes, you are permanently altering your architectural blueprint in ways the medical community doesn't even fully understand long term.
Well, the clinical consensus in these reviews emphasizes that we simply do not have decade-long safety data on what happens to human pelvic fascia after it has been repeatedly microwaved by alternating currents.
We really don't. The data just isn't there yet.
But if these long-term risks to future surgeries exist, you would assume there are massive warning labels on these devices. But looking at the landscape of cosmetic clinics, I mean, they are advertised like getting a haircut. It looks like a regulatory Wild West.
It really is a Wild West, but the regulatory bodies have recognized the disconnect between the marketing and the science. In 2018, the US FDA actually initiated a severe crackdown.
I read that FDA statement in our stack, and it is incredibly scathing.
Very much so. They issued a sweeping safety communication, explicitly warning the public against the use of energy-based devices for vaginal rejuvenation.
They essentially state they never approved any of these machines for these specific cosmetic purposes.
Right. The loophole clinics use is off-label application. The FDA clears these specific lasers and RF devices as general surgical tools.
What does that mean exactly?
It means they are approved for a surgeon to cut, coagulate, or ablate tissue in a general operating room. They're absolutely not cleared, tested, or approved for treating vaginal laxity, sexual dysfunction, or urinary incontinence.
And the FDA didn't just issue a polite warning about marketing semantics either. They cited real severe patient harm.
They absolutely did.
If you dive into the FDA's MAUD database, which tracks adverse events and complications for medical devices, the reports from women who underwent these lunchtime procedures are just horrifying.
Yeah, the complications are severe. We are seeing reports of third-degree vaginal burns resulting from poorly calibrated heat wands. Patients are reporting severe internal scarring.
I saw a mention of transverse vaginal septums. What is that?
That's a documented complication, where the thermal trauma causes a thick wall of dense scar tissue to literally grow across and block the vaginal canal entirely.
Wow. And our sources also list multiple cases of new-onset dyspareunia, right?
Yes, meaning women who went into a clinic for a quick cosmetic tune-up to improve their sex lives ended up with chronic severe pain during intercourse that they never experienced before the device was used.
Because the marketing equates these pelvic treatments to getting a facial, but the biology utterly rejects that comparison.
The biology is completely different. The mucosal, highly vascularized, hormonally sensitive tissue of the human pelvic floor responds to heat and trauma in vastly different ways than the keratinized, sun-exposed skin on your forehead.
It makes sense when you put it that way.
Right. Taking a laser built for facial wrinkles, applying it to complex internal anatomy, and blindly assuming the safety profile transfers is, well, it's biologically reckless.
Which is terrifying when you realize how aggressively the industry is pushing these treatments. You see the ads everywhere.
You do. And major professional organizations like the American Urogynecologic Society and the International Urogynecological Association are actively sounding the alarm.
What are they asking for?
They are demanding that Level I, multi-center, randomized clinical trials be completed and peer-reviewed before these devices are sold to vulnerable patients as a panacea.
They want rigorous long-term proof before the profit.
Exactly. Right now, the profit margins are drastically outpacing the scientific method.
So bringing it all together for you listening, if you are considering one of these non-surgical procedures to address laxity or incontinence, you have to weigh the marketing very carefully against the biology.
You really do.
You must balance the alluring promise of a painless 30-minute fix against the reality that you are fundamentally and perhaps permanently altering your deep tissue architecture.
Because you might get relief for 6 months or a year. But you could also be creating dense fibrotic scar tissue that closes doors or severely complicates the traditional definitive surgical repairs that you might desperately need down the line.
It is absolutely not a decision to make lightly on your lunch break based on a brochure.
Definitely not. A decision that permanently alters your pelvic floor requires a serious consultation with a board-certified urogynecologist. Someone who intimately understands both the limitations of thermal technology and the complex structural anatomy you're actually trying to fix.
And that leads me to a final, incredibly provocative thought we found buried in our sources today, something for you to mull over. Because these devices are cleared by the FDA simply as general tools, there is no standardized, mandated gynecological training required to actually purchase or operate one.
And that is where the regulatory loophole becomes truly dangerous. The data highlights a staggering reality regarding who is actually holding the wand.
Because the profit margins on these cash-only procedures are so high, it isn't just specialized pelvic surgeons buying these machines.
Not at all.
The sources explicitly point out a concerning trend of psychiatrists, emergency room doctors, family physicians, and dermatologists purchasing these lasers and RF wands, plugging them into the wall of their clinics, and self-proclaiming themselves as vaginal rejuvenation experts to capitalize on the booming market.
It perfectly illustrates the current disconnect in the consumer healthcare landscape. It's profit over expertise.
So I leave you with this question to consider. If you had a complex heart condition, you would never let a psychiatrist operate on your heart. You would demand a cardiologist.
Obviously.
So why is the medical industry allowing, and why are consumers paying, doctors with zero specialized gynecological training to use high-powered thermal wands to structurally alter their most intimate anatomy?
It's a question every patient should be asking.
It really brings us right back to that sagging floor in the historic home. Before you let someone blast away at the foundation with a heat gun, you better make absolutely sure they actually know how the house was built in the first place.